am Dr. Shankar, a neurologist at Sundaram Medical Foundation. The type of diseases that neurologists treat include some common diseases like headache, epilepsy, Parkinson's disease, vertigo, back and neck pain, and some serious diseases like stroke. Today I would like to tell you a few points about stroke. Stroke is a very common disease, and it is estimated that about 1 in 6 people will develop a stroke sometime during their lifetime. There have been numerous advances in the treatment of stroke, but the crucial point is that the patient should reach the hospital well in time. For that to occur, people should be aware what are the common symptoms of stroke so that they can immediately rush to the hospital. In the case of diseases like heart attack, the pain is so severe that the patient is forced to go to the hospital, but stroke is not like that. The common symptoms of a stroke can be remembered by using a mnemonic called FAST, F-A-S-T. F stands for face, A for arm, S for speech, and T, the person must note the time. So if he notices any numbness or deviation of the face, any difficulty in speaking, any difficulty in using the arms, he should suspect that he may be going in for a stroke, and to save time, he must immediately reach the hospital. Many times people feel that they might have slept on that side for one side for some time, so they may be having some weakness, so they'll say we'll wait and see. That can be very dangerous. So if the patient who is aware of the symptoms or the relatives are aware of the symptoms and bring the patient immediately to the emergency department, they can be assessed and a CT scan which is available close to the emergency department can be done, and we can find out whether the stroke is due to less blood supply to the brain, that occurs in about 85% of the cases, or whether it is due to a bleeding in the brain, which occurs less commonly in about 15% of the cases. If it is due to less blood supply, this commonly occurs because one of the arteries have been blocked. So that block can be removed by using certain drugs called thrombolytics. The important point is the thrombolytics should be given within 4.5 hours from the onset of symptoms. So that is the crucial time period during which this clot can be dissolved and blood flow can be restored. In some patients, the clot burden is very high and they may have to go for intervention. In our hospital, the emergency department is tuned to recognizing stroke, a CT scan is available, a neurology consult is available, and thrombolysis can be initiated for eligible patients in time. We also have the services of an interventional radiologist whose consultation can be obtained if further procedures are required. And for follow-up, we have an excellent intensive care unit where patients can be treated for a few days, then transferred to the wards. And we also have speech therapy, physiotherapy departments which will help in rehabilitation of the stroke patient. So to sum up, stroke is a very important, very common condition. If left untreated, it is a very big cause of disability. But if patients come in time, it can be adequately treated and very good results can be obtained. Thank you.